Hi, how often, as a homeopath, have you encountered that in your college the surgery subject which is being taught is maybe out of compulsion? Or maybe it's not that interesting, or you're possibly studying a subject which is not relevant because, any which ways, you're not going to go do surgery. Or maybe you might also be thinking that if you are even taught surgery, why are you not practicing surgery? And maybe because of this dilemma or this confusion, or because of your unanswered queries, you all the more start neglecting this topic of surgery or the subject of surgery, which ideally should be beginning to be taught or introduced to you in second year level. And in third year, you again postpone it till the extent that during your exams, maybe before a year, month or two, you are on your nerves, like, now I have to study surgery because I have to appear for the exams and pass. Has that been you? Well, if it is you, then I'm here. Uh, well, if it is you, then you should listen to this video. Uh, well, if that is you, then you should be watching this video because I'm going to tell you few reasons why, as a homeopathic student, or if you're a homeopath, you should be studying surgery regularly. Hi, I'm Dr. Tarun Zada, a consulting homeopathic physician and a medical college teacher in homeopathy in the subject of surgery for more than 13 years. And with my experience of teaching and taking exams in many colleges, I'm here to tell you reasons why, as a homeopath, you should be all the more keen in understanding this topic of surgery. Well, point number one, if you're pretty much aware, you know how Dr. Hahnemann shifted and moved to homeopathy. And after moving to homeopathy, he has actually given in the classification of diseases, surgery also being one. Well, that itself should tell us why we need to be understanding surgery. That it is something that needs to be advocated or advised to our patients at times when homeopathy cannot be of any use, or when it is direly needed. And the reasons actually he has mentioned in Organ of Medicine. In case if you haven't read it, go ahead and read it. Your doubts will be cleared there itself. Well, the second, if in case you are a homeopathic student and you have passed out and you are encountering some pathological conditions or which you are not aware of, maybe out of syllabus, so to say, you will not be able to understand how to navigate through it, how to go ahead and diagnose it, or how to even examine it if you haven't been someone who has understood how to go ahead with your surgical cases. Because if you haven't understood your surgery, maybe understanding even medicine becomes difficult in that point of time. बिकॉज कुछ बड़ी डरावनी चीज पहले कर लो तो बाकी की चीजें आसान हो जाती है, राइट? इट्स दैट इफ यू अंडरस्टैंड सर्जरी, अंडरस्टैंडिंग मेडिसिन बिकम्स मच इजियर, राइट? Then third most important thing is, in today's day and age, if you are treating a particular condition of knee pain and you end up saying, yes, I have cured osteoarthritis, what is the proof? Tell me, what is the proof? You will say every knee pain is osteoarthritis? No, darling, it will not be possible. You need to have hardcore evidence what you have treated. And how will you know how to prove it is osteoarthritis if in case you don't even know what are the investigations to be done, what are the examinations to be done? You will not know. For that, you should be sitting for your surgery lectures regularly, right? And then fourth, in today's day and age, again, you are living in a very close knit environment where all doctors are practicing harmoniously. Well, MBBS is existing for a reason. We have so many specialists existing for a reason, and they're thriving happily. But then they end up telling most homeopaths are so negligent that they don't even advise investigations. They don't even know how to diagnose a case. Well, are you amongst that? Don't be. Go ahead, understand how to investigate, how to diagnose. And the basis of the same is taught in surgery. Well, that's how you understand your general surgery, systemic surgery, ortho, ENT, opthal. I don't expect you to be specialist in everything because neither am I. But then that's what those specialists are existing for. When in doubt, you should know where to refer, whom to refer. वेल अगर वो पता ही नहीं है वो किस चीज़ का कंप्लेंट लेकर आया है पेशेंट, हम कहाँ पे किसको रेफर करेंगे, राइट? सो टू अंडरस्टैंड द बेसिक थिंग्स you need to first understand your topic thoroughly, so that you know your knee pain is because of OA, and this abdominal pain is because of some intestine complaint or something else. So I need to be referring to a surgeon for abdominal pain, I need to be referring to a ortho for knee pain. ये logic या ये immediate action to safeguard the patient, to give him a holistic health care will not be possible. Then fifth, I think we should be understanding that it's very essential for you as a homeopath. When you start practicing, you get the equal respect. Many senior homeopaths do get that respect. Many juniors also do get, if they are following what you say, a very harmonious practice, a very inclusive practice of all the pathies together. But if you are a homeopath who doesn't know how to stand up for yourself with good that the knowledge of physician is also important, which when Dr. Hahnemann advocates, and for knowledge of physician, you should be also having a knowledge of surgery, also knowledge of ENT, ortho, and dental, vagara, vagara. Then only I think your colleagues in different pathies will be looking upon you with respect. Now, don't you think that's the bare minimum? If you want every patient to come to you as a homeopath, I think they should know that you are a very knowledgeable homeopathic physician who knows the anatomy, physiology, surgery, medicine, the do's and don'ts, the limitation and scope very nicely. So I think अगर आपको उन लोगों से references भी चाहिए, तो आपका basic knowledge तो improve करना ज़रूरी है. And that's the reason why I feel, even if you are someone who is pass out, don't give up on your hope, because there's always a time to rewind, play, and study. I think study has no age limit. You can start studying at any given point of time. So now, for me, I wasn't a very great student in my UG, but then gradually over a period of time, as I started teaching, I started learning. As I started seeing patients, I started learning. But then you shouldn't say कि अभी बस हो गया, अभी मुझे सिर्फ पेशेंट को ट्रीट करना है, पैसा कमाना है, अभी मुझे सिर्फ सिखाना है या पैसा कमाना है. So yeah, that keeps you in a very close mood. Please go ahead, take your books, understand that there's new perspective. The science is always evolving. There's something new coming in your way. So take up your books, read your books, keep yourself open to learning new things. Now, isn't that great? If we keep learning to new things and updating our own knowledge, we'll be more receiving at a receiving end. We'll be more in a comfortable space to offer something new and good to our patients. And even if you're not currently someone who is practicing homeopathy, you might find something interesting if you start learning the subject well. You might be able to diagnose the patients accurately on time. You might be able to refer the patients to the right person on time, thereby understanding that the first aphorism of ours always holds true. The high and only mission of the physician is to restore the sick to health as it is, to cure as it is termed, right? So without much guilt, without much regret, without much of a feeling that the time is lost, I can't do anything, please take up your books, start reading. And I think now reading and knowledge can happen from all the sources. And go ahead, read. But always remember that no matter how old you are, reading should not stop. You should always be a lifelong student, right? And I personally feel that all homeopaths should therefore understand their subjects thoroughly, especially pathological cases if they are managing. Surgery is the basic of it. What do you think about that? Am I wrong? Or do you think there's much more reason why a homeopath should be understanding or reading surgery? Do let me know about this in your comments below. Hope to see you in the next video, and do let me know what else do you think about this video. Thank you. Bye.